Well, they're looking for a solution for an epidemic. The Congress is tackling the rise in opioid overdoses next week.
The Centers for Disease Control estimates 91 Americans die each day from drug overdoses. That's more than the number of deaths from shootings or from car crashes. And you can see the drastic increase here over recent years on that graph. At a hearing on Wednesday, one House committee hopes to find ways that the federal government can help lower that number. Well, Republican Senator Rob Portman from Ohio is backing a bill to stop the shipment of opioids through the U.S. Postal Service. Did you know that that's how they were transported sometimes? Senator, thank you so much for making time for us. Good morning to you. Tell us,
Christy,
first of all.
thank you, and thanks to you and Victor for taking up this issue.
Absolutely, absolutely. Ohio's my home state. We've been watching it closely. We would, whether it was my home state or not, of course, but it's really a crisis, no doubt, there in Ohio. Help us understand what your bill will do.
Well, the most recent legislation is focused on this new threat, which is fentanyl, which is a synthetic form of heroin, and it's coming to our country via the U.S. mail system, believe it or not. And the more research we've done into this, the more we've realized that if we can simply ask the post office to require the same kind of information sharing that other private carriers require, say FedEx or UPS or DHL, that law enforcement could target those packages that are suspicious and help to stop some of this poison from coming in. We've got great support from the Fraternal Order of Police, from the sheriff's associations around the country, also from law enforcement at the federal level, the Customs and Border Protection people, DEA. And it's a very sad situation now. You have labs, mostly in China, that are creating this poison and then sending it by the mail system to the United States. And there's really no effective way to target those packages. So that's what we're trying to do, is get that information to be able to target the packages and be able to stop some of these deaths we see. Here in Columbus, Ohio, where I am right now, we've had on average 1 death per day over the last 2 months from fentanyl. We're on track to probably triple the number of fentanyl deaths from last year. It's tragic and it's affecting everybody.
How, if you're going to have the post office track them electronically, as I understand it, is there any way to scan or to decipher what is actually being sent? Because I can't imagine somebody's going to declare it, as we do, say, with FedEx.
Yeah, it's a great question. They're required to provide advanced electronic information for these private carriers of, where the package is from, what's in it, where it's going. And that information can be used by law enforcement to at least target the packages that are most suspicious. And obviously the information as to where it's going is probably the most accurate information, since that will be where the destination actually is. So we're told by law enforcement that this information helps them a lot with regard to these packages that come in, again, through the private carrier systems. And it would be very helpful to have it with regard to the vast majority of packages, millions that are coming in through the post office. It's like finding the needle in the haystack right now. So this is one way to help deal with this issue. It's not the silver bullet, because there is no one silver bullet. I was at 2 treatment centers yesterday, one in Cleveland, one in Youngstown, and we have to do it all. We have to do a much better job on stopping the supply and at least raising the cost of this product, because, Christy, one of the issues is that fentanyl is so inexpensive now. It's taking the place of heroin. It's 30 to 50 times more powerful than heroin. It's being mixed with heroin. It's being mixed with other drugs. But we also have to focus on treatment and recovery, and prevention and education obviously is key to this. And it all comes together as a more comprehensive approach in this legislation called the Comprehensive Addiction and Recovery Act. And so we've got that legislation that passed the Congress last year. We're trying to implement that as quickly as possible. But in the meantime, let's do everything we can to try to keep some of these poisons out of our community. You
talk about how cheap the drugs are, but fighting them is costly. When you're talking about helping the U.S. Post Office, I guess they would evolve and they would become better at spotting this and helping you track. How much might that cost, and is that going to come at taxpayers' expense?
Right now, with regard to the private carriers, it comes at the expense of the shippers. In other words, they pay a small fee in order to have that information to be provided to the carriers and to law enforcement. And that's how the post office could do it. We could also provide more funding from the federal government for more postal inspectors, which I think we ought to do, because right now they're understaffed, in my view, to be able to handle this new information. So I think it'll be a combination. But Christy, a little more money up front is worth it. The devastation of this opioid crisis we now have in our country is becoming clearer and clearer. Here in Columbus, Ohio, just this week, a guy overdosed in a McDonald's parking lot. He had his foot on the accelerator. He crashed into 2 other cars. A week ago today, you had 2 little kids outside their folks' pickup truck at a city park in Columbus crying, and the police arrived and found both of their parents overdosed. In a movie theater in Columbus recently, someone overdosed and died. It's the #1 cause of crime in my state, and I think in the country now, is people who are looking for funds to be able to provide for their habit, and they're committing crimes to get that. So it is something that's affecting everybody. I'll be at a business roundtable discussion actually with Vice President Pence here later today, and I know what I'll hear from the business community because I heard it yesterday in Youngstown and Cleveland, and that is they can't get people to pass the drug test to be able to hire people. So this is something that affects every single one of us, and I think it is worth the effort.
Yeah, using the term epidemic is definitely accurate. I want to